This is in the Sunday Times on April the 7th, 2019, page 12. It's Opioid Inquiry's own expert fears whitewash report. This is a report by a supposed inquiry from Public Health England that's supposed to be investigating reports of long-term harm and addictions from antidepressants, anxiety drug, benzos, and opioids, which are given in mental health too. But it's including all these drugs, although opioids are the focus of the article, although the report includes though the other drugs I mentioned for the same reason, mostly so under the guise of mental health. And the article is on page 12. Opioids Inquiry's own expert fears whitewash report. Britain's opioid crisis. As 5 people die a day from painkiller use and addiction rates soar, an official review has been criticised from within. This is Andrew Gregory, a health editor. A government inquiry into Britain's painkiller crisis is beginning to feel like a whitewash, one of its own expert advisors has warned. In February, a Sunday Times investigation exposed a huge rise in prescription of opioids and soaring addiction rates, overdoses and deaths. After these revelations, the government pointed to an existing review being carried out by its health agency, Public Health England, PHE, as evidence that it was taking the problem seriously. However, it can be disclosed today that PHE, Public Health England, was warned in January by one of its own expert advisors that its inquiry was beginning to feel like a whitewash. The review, launched in January 2018 and originally expected to report back in early 2019, is continuing. It is examining addiction linked to opioids, anti-anxiety drugs, and antidepressants. Its panel of it is examining addiction linked to opioids, anti-anxiety drugs, and antidepressants. So the majority from a lot of it from under the guise of mental health. In its mental health places. Its panel of experts, which includes leading doctors, pain specialists, academics, and drug policy officials, expressed concern about the inquiry's interim findings, documents reveal. One member stated the review was beginning to feel like a whitewash, as the NHSBCA, NHS Business Services Authority, data did not capture the extent of the problem sufficiently. According to the minutes of an inquiry meeting in January. Others on the reviews, something that we've said a while, they don't record data for a reason. The drug companies do the testing, produce the reports, and no further questions or data or research is needed or asked for before it's approved, and people are used as guinea pigs in the mental health or wherever. Others on the review's expert panel also expressed concerns. Some members were clearly disappointed with the evidence base, the minutes revealed. Another said that he did not believe that the review was a whitewash, but that there were many contested issues. Public Health England itself was aware of potential limitations of the data, the minutes said. Last night, John Ashworth, the Shadow Health Secretary, said, "This high-level inquiry must leave no stone unturned in getting a true picture of abuse. Ministers must start demanding answers and urgently reassure us they are taking this seriously." He said the crisis demanded significant action from government. Rising numbers of Britons are being given potentially harmful opioids for chronic pain, despite evidence that they are mostly ineffective at treating it. And that would go for so-called antidepressant and anxiety drugs too, and any other so-called psychiatric drugs. About 5 people are dying every day. Many people have been on opioids for many months or even years with little or no checks by their doctor. Did I have any blood tests over all those years since when I was a child, little child? Nope, no blood tests over all that time. I had one maybe around the time I was on them, put on them, then no others until I got very sick. Then I had blood tests when I was very sick. And they said it's the mental health drugs causing it. Then they said no, it isn't anymore. 'Cause they didn't want to get sued by drug companies for saying they harm me, and then blame me instead. Alright, sorry, I'm getting distracted. Many people have been on opioids for many months or even years with little or no checks by their doctor. The documents reveal Public Health England's interim findings were based on just 3 years of prescribing data from 2015 to 18. As a result, the review would not show true duration of patients on continuous prescriptions for longer than 3 years, Public Health England was told. One expert said the review had not gone far enough back. The Sunday Times analysed a decade's worth of data. Since 2007, the annual number of opioids prescribed by GPs has risen by 10 million. Opioid deaths are up by 41%, and the number of patients hospitalised because of opioids is more than 11,500 a year. After this newspaper's investigations, the National Institute for Health and Care Excellence announced plans to develop guidelines for GPs on prescribing opioids and how to ease patients off them. Rosanna O'Connor, Director of Drugs at Public Health England, said, "Our review is looking at the evidence in a robust and systematic way, and we are considering the quality of the evidence throughout the process. Our expert reference group has an important part to play. We're aiming to publish our full findings in the summer." And I have noted that I used to live right next to Public Health England, and everyone was smoking outside it all the time. All the people who worked there. But aside from that, which is self-harm, which is totally their choice, as opposed to the harm they've done to me when I was already on so-called antipsychotics and so-called antidepressants. And then as soon as I turned 18, the adult mental place gave me Lyrica, a so-called anti-anxiety drug, which is opioid. That cocktail of polypharmacy. I was told I should have it. It's something of a wonder drug. It's been something of a wonder drug, so obviously it wasn't just me it was given to. That's Lyrica. That's an opioid. Do I have any compensation for all the injuries I've got from all those cocktail of drugs? I barely made it to adult life. I've got life-altering damages forever. Oh well, at least there's some kind of newspaper article, newspaper article about it, hey?